8:14 and a half, a good Thursday for us. We're happy to welcome back Dr. Brent Wallis, Dr. B from People's Health, to talk about senior health. Probably not your favorite thing to talk about, but if you are having a problem controlling urine, you're not alone. It's a common issue as people get older, and you might want to talk about it with your doctor. And Dr. B is going to join us right now to answer all of your questions about urinary incontinence. How you doing, Doc? Good to talk to you again.
Hey, Tommy, I'm good. Good to talk to you as well.
You ready for the 90-degree weather? It's here.
I think I am, actually. I'm ready to get rid of all that cold.
Yeah, and so long as that pool's ready, you'll be ready to go. Can you explain exactly what urinary incontinence is?
Sure. So urinary incontinence is really just the medical term we use for loss of urine control. So really, it's the inability for a person to hold their urine until they can get to the restroom. And it's extremely common. Millions of Americans have symptoms of urinary incontinence, and it can really strike people at any age. But in particular, we tend to see it in women who are over the age of 50. They're really the ones who are most likely to develop it. But we do see it in women and men alike. It can be a temporary condition due to a medical problem that you're having, or it could be something more persistent. And it can really range from just a little bit of discomfort or a slight loss of urine to really severe or frequent wetting or accidents that people have.
What causes it?
So what's really important to understand is that it's not inevitable. It's not something that everybody develops as they get older.
Hello? All right. Got a little technical issue there with Dr. B. We're going to, Tim, what do you want to do? You want to take a break? Or you want to get him? All right, we're going to get Dr. B back in a second because it is important. And I know I have known women personally that have suffered from this. I know childbearing can have a little bit to do with it. Sorry, Doc, we lost you.
Am I back, Tommy?
So you are. You sound fine. What causes it? That's where we were, I think, talking about urinary incontinence.
Sure. So what's really important for people to know is that it's not inevitable. It's not something that develops in all people as they age, but it is really common as you get older. So it's usually due to specific changes in the body, as you get a little bit older, usually resulting from other types of diseases, maybe related to some medications that you're taking or even the onset of a new illness. Sometimes it may actually be the first and only symptom of a urinary tract infection as well. So there's a lot of different things that can cause.
Okay. Tim, now I'd say we take a break and go to traffic a little bit early if we can, and then reconnect with Dr. B and figure out what's going on here. It is 8:17, and with fingers crossed, we go to traffic on WWL. 8:22, Tommy Tucker back with Dr. Brent Wallis, Dr. B, Chief Medical Officer of People's Health. A little technical trouble. We apologize for that. So, Doc, again, we're talking about, maybe we should skip the question because it seems like the phone cuts out every time we ask it, but the difference between stress and urge incontinence.
Sure, Tommy. Hopefully this is a little bit better.
Okay. The difference between...
Does that sound a little bit better?
Yeah, it sounds great. Yes, sir.
All right, good. So yeah, this is an important topic. So stress incontinence is typically really found in women after childbirth or sometimes in men after they've had prostate surgery. So it's usually due to a weakening of the pelvic floor, and so it can put a little pressure on your bladder. So when you sneeze or cough or you're exercising, you can get a little bit of leakage. The difference with urge incontinence is that you have a sensation that you have to go to the restroom. You may even rush to the bathroom, but when you get there, you may only have a small amount of urine. So they're slightly different conditions, and they're treated differently as well.
Why is this so important?
Yeah, I mean, this is very important because it's very common. It's very common as we get older, but a lot of people feel embarrassed having this discussion with their doctor or even sometimes with their family and friends. They may be afraid that there's no solution to their problem, or even worse, they may think that the solution is something like surgery and they don't want to go through that. But what people really need to understand is this is very common. The solution may be a lot simpler than you think. So the best thing you can do is talk to your doctor about what your symptoms are are, if they understand the issue, then they can usually develop a treatment plan for you.
How would you go about bringing it up?
It's pretty easy. People tell us a lot of things, so we're not surprised by anything. So usually just telling us is the best way to start the conversation. A lot of doctors, too, will include certain questions about incontinence in their exam. So they may bring it up with you, and that opens the door to a conversation. But if you're not comfortable talking to your doctor about it, one thing I suggest people do is write it down, keep a journal of what your symptoms are. And when you come in for a visit, just hand it to us, and we can read through what's going on with you and then try to create a solution for you.
And it might be the first time for the patient, but the doctor has talked about this often with many patients, so you shouldn't let that hinder you, I guess. What are some of the symptoms?
Yeah, so there's a lot of common symptoms, but keep in mind everybody experiences things differently, and they may have some and not have others. It could present with an inability to urinate or a difficulty kind of initiating urination. You can definitely get pain, and the pain can actually be not when you're going to the bathroom, but actually as your bladder is filling, or it could be when you actually do go to the bathroom, you can get a burning sensation. Another thing that's really important to let us know about is if there's a weakness in your urinary stream. So if you have some starting and stopping when you're trying to urinate, that's something real important to let us know about. Another thing is actually the frequency of urination. A lot of people will tell me, that they're getting up multiple times during the night having to go to the bathroom. That's not normal, but it is very common, so that's important to let us know. And then the other one is really kind of that urgency that you feel like you need to go to the bathroom, and if you don't get there in time, you may have an accident, and so that definitely is not common and something you want to let us know about. The other thing too is if you've had frequent bladder infections, that's never normal, can actually lead to some problems down the line. So you want to let us know about that as well. And keep in mind that these symptoms can actually happen with a lot of different medical problems. So you always want to talk with your doctor to figure out what the true diagnosis is for that urinary incontinence.
Are there things that people can do themselves to help with controlling the bladder?
Yeah, there definitely are. There's a couple of things that we talk to patients about. The first one's a little hard to describe on the radio, but it's called a Kegel exercise. You can ask your doctor about how to do them, but it's basically a muscle strengthening exercise for that pelvic floor, and it can help you hold your urine a little bit better. Another thing that's real important is limit your fluids at night. So usually after 7 p.m., if you're going to go to bed that night, you want to stop drinking a lot of water. Don't bring a glass of water to bed with you because you may end up having to get up and go to the bathroom multiple times throughout the night. And then a lot of people don't realize that certain types of food can really irritate the bladder and can cause frequent urination. And, that can be sometimes even milk, but definitely citrus fruits, tomatoes and spicy foods, and then carbonated beverages. And then obviously one that affects a lot of people is alcohol and caffeine, so it can lead to increased urination as well. And then there are some medications that we can prescribe to help with that frequency or urgency, but those medications can have side effects as well. So, again, you want to talk to your doctor about your symptoms, but if they put you on medicine and you have any problems, you want to talk to them about that as well so that you're not trading one problem for another. And really, I think the most important – oh, I'm sorry.
No, go ahead, please.
Yeah, I was going to say the most important thing I try to make sure people know, don't be embarrassed. Talk to us about this and don't give up because there's a lot of different ways we can treat this. So if the first thing doesn't work, then, try again. You've got a lot of options.
What I was going to say is one of my favorite treats, and my daughter just thinks it's the grossest thing in the world. I like Diet Coke and milk mixed together. Call me crazy, but I do. And that's probably, for people that like that would maybe be the three of us that are out there. That could be a bad thing because you're mixing milk and carbonated beverages, right?
Yeah, and a little caffeine in there, too. So that definitely could cause some problems.
Tell me about people. Does that sound gross to you, doctor, or not?
I don't think I would do it, but I guess it's not that much different than a Coke float.
That's the point. It's not bad. It really isn't. How can people find out more about People's Health?
Sure. We've got a lot of information on our website at peopleshealth.com/radio. And obviously people can follow us on social media at Facebook, Twitter, or Instagram.
And you can call 866-687-7335. And I think the takeaway here, doctor, is before you start another medication or get on another medication, talk to your doctor and try some of the things that you can control before you start taking more medicines, which can have side effects and interacting with other medicines, et cetera, correct?
Yeah, and be honest with us, and please don't be embarrassed. We've heard a lot of things, and we want to talk to you about this for sure.
Thank you, Doc. Appreciate your time. Have a good week. Get in that pool.
Thanks, Tommy. Talk to you soon.
Be a good weekend for it. You bet. Be a good weekend for it. You bet.